Member for Fredericton South and Leader of his party.
Mr. Speaker, I give notice that on May the 27th, 2021, I shall move the following resolution, seconded by the member for Member-Coquitlam-Tomar. Whereas the mental health care system in New Brunswick is failing to meet people's needs due to long wait lists, access issues, and underfunding, whereas the COVID-19 pandemic has intensified feelings of stress and anxiety, causing alarming levels of despair and hopelessness in some parts of New Brunswick's population, whereas there are challenges to access mental health services in New Brunswick, where wait times can last from 6 to 18 months for service, whereas suicide remains the second leading cause of death in Canada among young people aged 15 to 24, and in New Brunswick we have the highest suicide rate per capita in Canada, whereas the Office of the Child and Youth Advocate recognized that New Brunswick is lacking an effective provincial strategy for youth suicide prevention, whereas the Canadian Mental Health Association of New Brunswick estimates that the percentage of the provincial population having suicidal or self-harm thoughts has increased from about 2% to 10% in just the last year, whereas the Canadian Mental Health Association recommends increasing mental health spending to 9% of the total health budget, yet the provincial government has allotted in the current budget only 5.5% of the total health budget, whereas the Legislative Assembly urged the government for the creation of the Mental Health Advocate in 2019, and yet this position has not been created, whereas there is a chronic shortage of registered school psychologists, with 23 of 38 funded positions in the Anglophone sector vacant and 14 of 38 funded positions in the Francophone sector vacant, whereas ongoing staff shortages forced the 4-bed inpatient youth and wellness unit at the Moncton Hospital to merge with the provincial child and adolescent psychiatric unit, bringing the total number of beds for youth in crisis down from 10 to 6, whereas a central system of governance for the integrated service delivery program would ensure that the sharing of information and financial resources among the ISD partners flow in a timely manner to properly address the child's needs, whereas the death of 16-year-old Lexi Dakin, who committed suicide after waiting in an emergency room for over 8 hours to see a psychiatrist and didn't see one, has sparked calls from the New Brunswick government to transform the mental health care system, specifically on how it's being delivered to young people. Whereas as a response to the mental health and addiction crisis in New Brunswick, the provincial government has launched a 5-year interdepartmental mental health and addiction action plan, which will establish 14 mental health clinics across the province. Be it therefore resolved that the Legislative Assembly urge the government to add 24-hour emergency mental health services to the mental health walk-in clinics being established around the province. Be it further resolved that the Legislative Assembly urged the government to commit to increase the proportion of health spending devoted to mental health to 9%, and be it further resolved that the Legislative Assembly urged the government to create a new government department responsible for child and youth services, with a legislative mandate to ensure the integration of services to children and youth across all government departments and agencies. Thank you, Mr. Speaker.